Tulsa has always been the tale of two cities. We just commemorated the 100th anniversary of the 1921 Tulsa Race Massacre. Greenwood was an economic mecca of Black entrepreneurship. 40 city blocks of commercial businesses, homes, a strong, viable community. It was the place to be. It was also called Black Wall Street, coined by Booker T. Washington himself. And it was also called Little Africa, speaking to the communal spirit that Greenwood had. Greenwood had an economy within an economy. It was doctors, it was hospitals, it was clinics, it was everything you could think about was right here within this community. On May 31st, 1921, 35 blocks of Greenwood was looted, burned to the ground, and bombed. There were hundreds of people who were murdered. The city has only documented 36, but there were more based on Red Cross and based on eyewitness accounts. So from May 31st to June 1st of 1921, what we known of Greenwood, Little Africa, was burned to the ground. So this is where the Dreamland Theater actually was. It's right here. Just imagine this highway not being here. And this Dreamland Theater was owned by Lula and John Williams. The Dreamland was a fancy theater. Not only did they hold movies in there were theater shows. They had community meetings in the Dreamland Theater. Everyone loved to come to the Dreamland Theater, even my great aunt Janie. On May 31st, 1921, the massacre happened here in Greenwood. So my great aunt Janie was 17 years old on a date. She was not supposed to be on this date. It was a secret date, as I'm sure most teenagers have done. But she was on this date here when the massacre happened. I just know that she said that they ran away going down some railroad tracks. And that's where a lot of people were going on these railroad tracks. And she escaped with her life. Just that traumatic experience and that trauma that you live every day just by coming through here and it being a reminder of what happened. And you don't want to hide it, you want to tell it. So there is a trauma in that. Remembering what took place here, it almost makes me emotional thinking about it because, you know, this is still a crime scene. I keep saying it's still a crime scene. It's sacred ground. This was where Dr. A.C. Jackson's home. It stood right here in this area. And on the night of the massacre, May 31st, 1921, a white mob came and ordered him to come out with his hands up. And Dr. A.C. Jackson came out with his hands up and they shot him. And he not only serviced this community, but he was called from all over this country for his services. He also created tools for surgery that are used today, but that's not acknowledged and really talked about the way that it should be. And his neighbor, who was a white man, he said, "Do you guys know who you just shot? You shot that Dr. A.C. Jackson. He's our only surgeon." So they put him on the back of the truck. They took him to the convention hall, but in between there's another story that someone actually tried to get him help at a white hospital, but they would not accept him there. So it's so crazy that Dr. A.C. Jackson, who did these surgeries on white people as well as black people, but was not welcome into a white hospital to get help. So he bled to death right there on the back of a pickup truck, right in front of the convention hall. The convention hall, it was an internment camp. They separated the families. They took the women and the children, they put them at the fairgrounds, and then they kept the men at the convention hall. A lot of men went in, a lot of them came out in body bags. And so today you have concerts and going on in that same facility that was an internment camp for the black residents of Greenwood.
Kristi, we know that North Tulsa had a thriving and self-sustaining healthcare infrastructure prior to the race massacre. Here we are, we're standing in an empty field, which was once the home site of one of Oklahoma's great surgeons. Do you think that this is sort of illustrative of the way that racism can carry forward and impact healthcare for an entire generation of people that live in a community like this?
When I think about the health infrastructure that we had here that is no longer, but there's no solutions that ever comes from it. We are in what we call Deep Greenwood, and we're right here in front of the Church of Restoration, which actually used to be a clinic. It was built in 1946, and Janice Jones ran this clinic. She was the first Black registered nurse in Oklahoma, and she wanted to start her own clinic. It took her to 1946 to do it, but she did it. This was her dream, and now you see her dream gone. You know, there is just no easy access to health care. And it's really crazy because when you think about in those days how you had health clinics, hospitals, but today there is no urgent care here in North Tulsa.
I know when Medicaid expansion happens on July 1st, it's really going to help a lot of people have greater access to care.
Not only with just day-to-day access to care, but also with the kind of life-saving care that comes with cancer screenings, regular screenings in the form of breast and cervical cancer screenings, colorectal cancer screenings. What kind of impact is that going to have on this community?
That's going to have a huge impact, and especially for people like myself who have insurance. You know, we need to really utilize that, but for those people who don't, it is great to have those screenings right here in this community. So right now we're standing right at the dividing line. This separated the black side, the white side, literally. And so this is those tracks.
So what you're saying is, despite the fact that, you know, we have this bridge here, the railroad track was the dividing point. This is North Tulsa, this is downtown Tulsa.
Right. This is the wrong side of the tracks. Definitely.
This dividing point is also a dividing point really when you look at health disparities, about when we always talk about the difference in life expectancy between North Tulsa and Midtown/South Tulsa, but also your access to care.
Yes, you do. And again, there's no health clinics, urgent cares in North Tulsa on this side of the tracks. But you have to go on this side of the tracks to get urgent care.
Wow.
Or just emergency room. Right? Doctor's offices, where there's not any of that, you know, really in North Tulsa.
When we talk about health disparities and health equity, we know that Medicaid expansion can open so many doors for so many people in Oklahoma. And just since the passage of expansion, we've seen people sign up. We've seen 100,000 Oklahomans sign up in a matter of days for Medicaid expansion.
Well, the Medicaid expansion definitely has helped, you know, the community get access to health care, but also people can't even get jobs here who live in this community, right? So we have to talk about those things, and better jobs, access to health insurance, health care, those things are definitely needed right here in this community.
Kristi, we're at a site in North Tulsa, which is known as the Steps to Nowhere. Can you tell us why these steps are here?
These steps are here because urban renewal, what we call urban removal, got rid of a lot of these homes. And it's just a reminder of the lack of development, the lack of homes that exist in North Tulsa that are affordable for North Tulsans. If you want to see a doctor, you'll have to travel 15 to 20 minutes away from here, which is no problem if you have a car. But there's a lot of people who don't have cars, and some of those people have to take 1 or 2 buses to get health care. Here in Tulsa, Black people live 11 years shorter than our white brothers and sisters on the other side of the tracks. So it's blatant, the data is there to prove this. The kids have more cases of asthma. We have cancer in this community, high blood pressure, diabetes. We have too many health issues and no place to go for them. Medicaid expansion is a great step in the right direction. It's not going to solve every problem, but it's definitely going to set the stage. It's not that there is no will to want to do better, there's just no way right now. And Medicaid expansion creates a way to make it better for people in this community and other communities. It is a tale of two cities, and you have to be blind and crazy to not see it or to recognize it, and we have to stop being afraid to talk about it. If we're ever going to be that one Tulsa, we have to acknowledge and really just address these issues that we have together. This commemoration was just a reminder of what we need to do, showing us all the time we've wasted, and where do we go from here? That's what the commemoration was about. Where do we go from here?